target enrollment number for the end of December is 3.3 million. Based on HHS's release this morning, your department is more than 3 million off their target number. Isn't that correct?
Through the end of November, that is correct, sir.
Uh-oh, the administration's target for Obamacare enrollees off by nearly 90% so far. And those signing up are likely not the young, healthy ones the system needs to pay for all the new costs from the law. So are you about to see your health care bills go up even more than they already have? Hi, everybody. I'm David Asson. Welcome to Forbes on Fox. Let's go in focus with Mr. Steve Forbes, Rick Unger, Mike Ozanian, John Tamny, Rich Karlgaard, and Elizabeth McDonald. Steve, we've already had sticker shock. Is this going to go up more?
Of course it's going to go up more. Networks are being restricted. Deductibles are being raised. Doctors are being restricted that you can go to. Same with hospitals. And young people know now, they're learning more and more, that you can get the insurance if you actually have something happen to you and you need it. So unless something happens to you, they're not going to sign up. So it's adverse selection. We're seeing it unfold now.
And Rick, when you have a 90% failure rate based on their own targets, you know the costs are going to go up, right?
Well, here's the problem. The White House kind of set themselves up by creating this target. I don't care if it's 10 million or 2 million. I do care about the mix. If the young, healthy people don't come, then you're right. We got a big problem. We won't see that payoff in price increases in the next 2 years because of the risk corridor. However, after that, if we don't get the right insurance blend, it's a very big problem.
But to Rick's point, Rich, the fact is that it seems that the people signing up are not the healthy ones that are going to pay more into the system than they take out. They're the sick ones that are going to take more than they're going to put in. And then you have this. Look at this figure. 800,000 of the people signing up are going directly to Medicaid or the CHIP program, Children's Health Insurance Program, which come right out of taxpayers' bills. So these costs are going up.
Yeah, in insurance terms, it's an actuarial time bomb. The Obama administration made a key mistake because millennials, that would be 18 to 29-year-olds, supported him overwhelmingly in his 2 elections. He assumed that he could pass on higher costs to young, healthy millennials. Well, a Harvard University poll showed that simply isn't so. Only 14% of that age group says they will sign up, and only 19% says they will probably sign up. So you've got only 1/3 of the millennials, healthy young people, right, who say they're going to participate in Obamacare.
EMAC, we actually have those poll numbers that we can put up. The fact is that the healthy people are the ones that are going to make this thing survive. If it survives, if they don't sign up, this thing's dead.
Yeah, and you know, I'll tell you something. It was always on a wing and a prayer, a moonshot, that you're going to get the young to sign up. Try to get the young to do anything, really. I mean, any parent can tell you that. But, you know, well, hey, wait. We've got now the White House dragooning Adam Levine, the sexiest man alive, to be a prudential government insurer. What a buzzkill that is, to get more young in. I don't even know if that's going to work. Here's the problem. The government will not disclose the demographics, whether or not the young are signing up. We don't have that data yet, David.
Well, John Tamny, by the way, do you think, John Tamny, that just getting a rock star to promote this thing is going to work, get the millennials to come on board?
It may hurt, but the bigger thing is, once again, and we've all hit on it, there's no low-cost insurance without healthy people, so naturally premiums are going to go up. But I think the bigger problem here is that neither Republicans nor Democrats understand what insurance is. It's supposed to be for the catastrophic, for the wholly unexpected. Right. And if you wanted to make that kind of health insurance universal, it would be very simple, and the markets could provide it at a low price. Any scenario under which the government oversees this is going to be expensive because politicians want us to have insurance for routine doctor visits. That is not insurance.
Well, for routine doctor visits, and Mike, for things that people don't want, like a healthy, young, single 28-year-old getting maternity insurance. I mean, the fact is that they're not signing up because it's a lousy plan. The president likes to call everybody else's plans, the 6 million who have lost their plans, lousy. But in fact, his plan is lousy.
David, you're exactly right. For young people, Obamacare is nothing more than extortion. Why would you have to fine somebody for not buying it? We don't fine people who don't own a car to buy if they don't buy car insurance. It's absolutely ridiculous.
Yeah, and even for the sick people who are signing up in the in insurance exchanges, they're seeing their deductibles 42% higher than the average has been at $5,200. Even if they make just $25,000 a year, that's a lot of money for the people signing up to Obamacare.
Rick?
Here's what's amazing. For years, the conservative argument has been get more skin in the game. Well, that's what it's done. It's raised deductibles, and now you're complaining.
For a poor sick person, which was intended to help?
I'm a poor, well, that's not necessarily
$25,000 a year.
This is what you've been asking for.
No, I am not been asking for that.
More to the point. I know you guys don't want to hear this, but you are jumping the gun. Yes, it is absolutely true. In the first 2 months, we're not seeing the young people come. Give it a little time.
So
I know you don't like that.
Agree with Nancy Pelosi.
Hold on, I want Steve in here because, Steve, the fact is that what conservatives have been asking for is for individuals to take control of their own insurance. And the problem with Obamacare goes exactly in the opposite direction.
It raises deductibles.
That's right, and that's why you should have choice. If you want a low deductible plan, fine. If you want a high deductible plan, that you should have that choice. And one of the things that's going to happen now, especially with Medicaid growing and Medicare growing, is more and more doctors, because of low reimbursement, are to take those patients. And as a result, you're now starting to see hints about regulations saying doctors must treat those patients. Right. So it's more and more government coercion. And government can only reduce costs by rationing.
Rich, the fact is that what young people want, if they want any insurance at all, is a catastrophic plan, not one that has all of these prerequisites that you have to have, you have no choice about with Obamacare.
Yeah, David, and really that's all they can afford. You know, let's remember that this debate is occurring in the context of a pretty shaky economy, and it's particularly shaky for young people. The millennials have an outsized unemployment ratio compared to anybody else in the economy, and so you're asking the people most pressed upon by this lousy economy to pay the most money. And is it any surprise that they're not enthusiastic about signing up?
Actually,
go ahead, Emac.
Actually, only 41% are getting subsidies of those who have enrolled so far.
But John Tammy, the fact is that, again, without the young, healthy people going in, we're all going to have to pay it, either through higher premiums or through higher taxes, one way or the other, right?
That's right. This is basic economics. If you have the riskiest people paying into the pool, naturally it's going to cost a lot more. And we've got to get back to basics. If we are a nation of individuals, some want very little, some want a lot. If everyone pays for what they want, we have a very easy insurance system. The problem is when we try to give people insurance on the backs of others, it's going to mean expensive for everyone and very little people as a result having insurance altogether.
By the way, Rich, I'm just wondering, you know, the people who don't buy into this, particularly the healthy young people, they're supposed to pay this fine. Of course, there's a question of how you impose the fine. I know a lot of young people who are not paying off their student loan bills. Do you think they're going to pay off these fines? I don't know if they will.
Well, I'll tell you, you know, I mean, the millennials were predisposed to support the administration and Democrats in general. If this administration actually requires poor young people to pay that $2,000 fine, they will have lost a generation of support.
I don't know if they will. Do you, Rick? Are they going to pay these fines? They're going to have trouble getting these fines.
They're not going to be very high in the beginning, so I don't know. But more importantly, I'm hearing more arguments across points. Insurance has always been, any kind of insurance is on the back of others. When somebody's house burns down, people who didn't have their house burned down.
You have a choice about what kind of policy you want. No, you do not. Obamacare forces you to get this, this, and this, and maybe I only want that.
And then you don't even get the doctors in the hospitals in the back end.
John Tamney, what is it, John? Go ahead, finish your point.
Well, Rick's point, they're forcing us to be on the backs of others. If we had a choice to choose what kind of pool to join into, it would be a different scenario.
It has not been that way.
And it's going to be expensive.
Right, Rick Unger, it's not been that way with a government issue plan. And it's never been that way with the set
state
standards.
Regulations
Wait, hang on. Where 80-year-olds now have to get maternity coverage. I mean, really?
How about states that have for years put these things into health plans?
There are more choices in that.
No choices.
How about all the states, Rick, that don't like this plan and don't want to sign on to it? Who gets the say there, the states or the feds? What do you say, Rick?
I'm not sure I even understood the question.
A lot of state insurance companies don't want to go along with Obamacare, and yet...
Then they won't offer something into the exchange. You know, people forget that there are non-exchange plans you can still buy. They have to meet the minimum requirements, as they always did in the state, but you don't have to the exchange.
This thing is one hell of a mess. I mean, if you want to sum it up, that's how you sum it up.